The COVID-riddled coral princess docks in Sydney as Queensland's case numbers climb sharply.
Fresh COVID warning for seniors as Queensland approaches the peak.
The modelling is in and mid-August is when cases will be at their worst.
The calls for definitive rules are growing.
Who do we trust anymore? Wear masks, don't wear masks, don't wear that mask. Work from home, don't work from home. It's better if you work from home. Don't go out, stay home. We don't know who to trust anymore. It is a little bit terrifying.
But both state and federal governments are adamant the time for the big stick approach is over.
I think we have moved deep into the third year of the pandemic to a phase where people don't want government mandates.
States going against official health advice to bring back some measures, preaching common sense instead.
The onus is on the individual, but we are monitoring what is happening in our hospitals very carefully.
Just because we don't have mandates, it doesn't mean we're saying things like don't wear masks. If you can practically work from home and your employer allows it, then of course it's a good time to do it.
Confusion brewing between employees and employers over their rights and obligations.
The reality is most people don't work in high corporate jobs, mate. Wake up. So it's not as simple as that, but I just think we could be precautionary.
The government backing boosters to get us through a wave that at its peak could eclipse the worst of January's Omicron outbreak.
It's likely over coming weeks that some millions of Australians will catch COVID. Some of them catch COVID again after perhaps having caught it earlier this year.
This comes just as the safety nets we've relied on, telehealth funding, free rats for low-income earners and the COVID worker payments have been cut back or scrapped altogether.
You will go to work if you haven't got a backup because you need those wages. It's that simple. So I guess, if he wants to play Russian roulette like that, then let him take that and let him make those decisions.
No one wants to go back to lockdowns, but as we head into what may be our worst wave yet, have governments got the balance right?
Dr Chris Moy is the Deputy Head of the Australian Medical Association and we spoke to him earlier. Chris, what do you think? Is appealing to common sense the right approach?
Look, what I'd say is we really need to get the message through to everybody, and this is on behalf of my colleagues, that we're really worried about the wave and we're really worried about the number of people in hospital already. They're going to get overrun. And what we need people to do is to get their shots, whatever they're eligible for, to make sure that if they get sick, they stay at home and that they actually get tested, ideally not relying on a negative one of these, get a PCR test because the rat tests aren't good enough, wear a mask whenever they can. I think at the moment what we need is really clear messaging from the government about what people need to do.
You mentioned the wave there. We've had lots of waves come along the way, but this one sounds like it's particularly bad. That's the conversation around it. How bad do you think it's going to get?
Okay, I'll give you several levels. A lot of my colleagues behind the scenes, the authorities that are in behind the scenes are really worried about it. That's the fear level's high. I think the next thing is that we're talking about numbers that are going to be as bad, if not worse, than early this year in January, and potentially for variants which are possibly got greater propensity for the lungs, which means that a greater proportion of people end up in hospital. And I think the other thing is we're in winter now and we're in a much more vulnerable position as far as our hospitals getting overrun at the moment.
How do healthcare workers feel about these lack of mandates? Because they're the ones that are dealing with the consequences on the front line.
Well, I think there is actually a lot of complete exhaustion. Can I say that? Can I just tell you how exhausted people are and they're just about to go another round while they're in the middle of winter at the moment. So there is enormous fatigue and please think about them, but also think about the people around you. I do think we need to get that community spirit backed by good government decisions to back community doing the right thing for each other, and that's where we need to be at the moment.
Doctor, the government is refusing to continue pandemic sick payments and free rats, and it's gutted telehealth. Are you surprised that they're not continuing those things given we're only halfway through winter?
Well, that's the problem, you see, because I think there is a little bit of, look, it's really serious and you need to get your vaccines and you need to get antivirals, but we're not going to support you staying at home, so you spread it around and you could actually get more people infected at the same time and speed up the pandemic with pandemic payments. You might not get tested, so you won't get your antivirals. The GPs won't be able to prescribe the antivirals, and also, pharmacies won't be able to deliver the actual medication to you. Look, sometimes just basing decision on economics is actually a false economy, because not only do you actually risk people's lives, you actually risk the health system and the community, but also what actually happens, it costs you more because more people get sick at the same time and your community in terms of industry doesn't get work properly.
Well, Chris, all the best in the months ahead. We know how much you've got on and how hard it must be at the moment. Thanks so much for your time.
It's a pleasure.
I do find it staggering that we've been told, well, for almost a year now, winter will be the worst, and we have not taken that information on. We are relaxing everything.
It's a bizarre thing. So things are pulling in opposite directions. The COVID situation is getting worse at the same time as the rules are getting laxer.
Yeah.
And we didn't even mention the international border, so we removed all the restrictions on that as well, like no vaccination, etc. I just wonder, do you think this is the price of the zero COVID strategy that we pursued for 2 years? Right? I'm not saying that's necessarily the wrong strategy, but
going so hard, the exhaustion levels of everyone.
We went
people
so
are too
hard.
fatigued to do this kind of stuff. Or is it the government assuming people are too fatigued? Because if the government told me I have to wear my mask again for a month, no issues.
Yeah, but you're Rachel Corbett. You're very different.
Okay,
I mean,
right.
No, and I don't mean that as... But really, would you want to be the leader of a government that stood up and started reintroducing rules? Would you want to be that
No, but
leader?
the mask is the least sort of, lockdowns, and those are the things that we know can lessen the impact and prevent us from getting to that point. So a mask, I feel, is a very small ask of us when we have done all that we've done. We're not asking to stay at home. We're not saying you can't go out to dinner with your mates, but just in certain circumstances, put something over your face. That seems such a minor thing to me. It seems so strange that the government won't just step out and say, guys, for 3 weeks, we're going to see where this rolls. Can we get everybody wears masks indoors again? I don't think that people would be up in arms about that.
I reckon that's probably right, but I reckon there'd be a portion who would see that as the beginning, more restrictions are coming. And then...
But let's grow up.
Sure, you can say that, but if people are really, really tired of it, this is what politics is, right? It's about what's possible. It's not just about what's ideal. I just wonder if the governments are too spooked to do anything like that.
Well, we are in... This is not normal times. We're not you can't expect a government to work on a set of circumstances that we've not seen before. So it's up to us to grow a pair and step up and go, you know what? Is it going to impact my life for 2 months to 2 weeks if I put a mask on? Probably not.
I love Rachel Corbett's impending political... I love the slogan, Rachel Corbett, grow a pair.
Yes, please, grow